Thank you very much, Mr. Chairman. Thank you very much, all the audience, to be here. And my issue today is to talk about tumors and tumor-like conditions in the hand and wrist. And first, I have to thank all these people, my friends, which I sent a mail asking for cases, and they sent me this huge amount of amazing cases that I cannot share with you today. And thank you for Hans Blum that allowed it to help me with some cases and to shorten the lecture. We will be here till ECR 2015, showing in all the cases. So my objective today is to learn how to analyze a patient with a clinical suspected tumor, how to differentiate a tumor from a pseudotumor, to analyze ultrasound and MR features of the more frequent tumors, and to be able to diagnose the more frequent causes, especially of soft tissue tumors, because we cannot discuss all the synovials and the bone tumors. So when we are facing a hand and wrist tumor, we have to look at with where it's located, which is the clinical context, which are the radiological features, and which is the age of the patients. And with that, we have a huge amount of variabilities and features that we have to merge. And first, we have to merge it where it is located. First, is it single or is it multiple? If it's in the bone, in the synovial tissue, or in the soft tissues. The second, which are the radiological features, and the more important is that if we can find calcifications, if we can find blood, if we can find how is the vascularization, or if we can find some fat. And together, what's the missing link? How we can make the diagnosis? Well, what we are missing is the clinical context and the lab test. And with this, we will be allowed to do the diagnosis in the hand and wrist almost in 80% of the cases. And that's what we are going to discuss, especially in the soft tumors, soft tissue tumors. So we are going to start very briefly when it's located in the synovial tissue, in the joint, in the bursas, or in the tendon sheaths. And the differential diagnosis is very wide, and depending on the radiological features and the clinical context, we are going to be able to do the diagnosis. So first of all, you have to remember that the wrist is divided by closed compartments, and they are divided and closed by some small ligaments or fibrocartilage. When this is broken, we have communication between all the compartments. Remember that in the flexor compartment, we extend almost to the fingers with a small gap. But in the extensor compartment, there is only in the wrist and did not extend to the fingers. So this is just to show you this case. We have a huge destruction of the bones. We have erosions. We have soft tissue swelling. And without a clinical context, this isn't a specific diagnosis. If we know this patient had a normal film and he was bitten by a dog, we know the diagnosis is an acute infection. And then we can make a specific diagnosis. And the MR will help us to rule out which is the extension of the lesions, if it has osteomyelitis and septic arthritis. Okay, we're not going to talk about rheumatoid arthritis because it was covered by my colleague before. Just remember that although it's not usual, sometimes because of the swelling, especially if there is affection of the tendons, we can come with a soft tissue tumor. Okay, and then we have to face atypical synovitis, and we have to try to find some small structure, some small features, radiological features, that can help us to do the diagnosis. So we have to look what's located inside those synovial tissue, and we can see if we have some nodules, or if we have some deposits. And we are not going to talk about CPPD like in this case, because usually do not come for rule-out soft tissue tumors. But some of the other cases of gout or hemosiderin deposits can happen.